Hello everyone. Today I am going to explain about NNAS. NNAS is National Nursing Assessment Service. It is for to get the registration for nursing registration in Canada. Same like the people who apply for USA, they do CGFNS verification. Same like that, we do the registration for Canada. Before that, the document verification called NNAS. NNAS is not in Canada, there are some other verification agency also available other than NNAS. But most of the province is accepting NNAS. In NNAS, mainly two types. One is main application, another one is expedited service. The main application and expedited service is not deciding by us. It is deciding on the base of province where we are applying. First of all, if you plan to start the NNAS, you have to fix your province where you are going in Canada. When we submit the NNAS application, we have to confirm this application go to which province. So yourself, we have to confirm which province you are going. If your spouse is in one province, you can fix to the province you are going, or maybe you're going to that province. Or if you got an offer from any province, you can fix to that province. So ultimately, if you are applying for Canada through NNAS, you have to fix your province where you are going. NNAS, as I said, there are two types. One is main application, one is expedited service. Main application means the verification will go from your college, nursing councils and hospital where you have keep the experience certificate. Along with the main application, if you choose LPN also, if you choose RN as a main application and if you choose LPN as a sub application, you have some financial benefit. Normally, if you apply for Canadian nursing NNAS, your fee most probably will come 600 Canadian dollar, like about 600 Canadian dollars. But if you additionally add LPN along with this main application, then the LPN you will get 200 something the charges. But if you do separately, you have to pay the separate fee for it. So if you are planning to go to Canada and if you did not complete your NCLEX examination, you are planning to attend the exam once you go there. If you want to do the LPN and RN, we do not know whether we will pass RN or not. If you did not pass RN, if you want to convert to LPN, if you do this NNAS right away, then this verification report you can use. If suppose if you did not get RN and if you want to do the LPN verification, you have to do the verification again. So if you are doing together the verification LPN and RN same time, the verification is a little bit easy because the hospital verification, council verification, college verification, there will be two forms, but we can send it same time. So the verification will complete soon. So you can use it. But even if you pass the NCLEX RN exam for Australia or Canada or USA, then you do not want to go for LPN, you can apply for RN only. At the same time, expedited service is a little bit different than main application. In expedited service, there is no hospital verification. Only the verification from the council, nursing council. And the education verification, normally if you done any verification, IQS or WES, any verification you did before, then that report has to transfer to NNAS. You do not want to verify this NNAS college verification. What you have to do, if you complete the WES earlier, you have to contact the WES and you have to transfer the report to NNAS. But sometimes when you when you apply for WES, it might for immigration purpose. But the immigration purpose WES is not acceptable. You have to do the course by course verification. So if it is not happen, then first you have to apply for WES for the course by course verification. Once it's complete the verification, the report has to send to NNAS by WES. In Canada, there are some other verifications also, as I said, some other verification also is there. And the application pattern is entirely different for different province. So first we have to finalize the province, then we have to think what is the application for that province. As per that, we have to take the action. And normally we suggest the candidate who wants to go to Canada, we prefer them to attend the NCLEX examination for USA and transfer the result to Canada. Why? Because in some province in Canada, we cannot attend the examination from outside the Canada. Once it's reached the Canada, only you can attend the examination. So if any difficulty to pass the examination, if you are not passing the examination, you will struggle there. But instead of that, if you clear the examination for the USA, then your main part is completed. You can transfer the result and you can do other documentation, you will get the license. But if you are directly some province in Canada, once you reach in Canada only you can do the NCLEX examination. If you are not passing, then it will be difficult for you. So normally we prefer the candidate who wants to go to Canada. We are telling them to attend the examination for USA NCLEX RN. Once it's clear the examination, start the process for Canada. But in case of you are applying for Newfoundland and Labrador, then you do not want to apply for USA. You can directly apply for CRNNL. And this exam also you can attend from India. So no issue. We can do all documentation from outside the country. So you can clear the NCLEX RN examination and you can go.